I went through 2 years of campaigning, and I'm telling you, no matter where I went, people were suffering so badly with the ravages of Obamacare. And I will say this, that as far as I'm concerned, your premiums, they're going to start to come down. We're going to get this passed through the Senate. I feel so confident.
Welcome back to America Talks Live. I'm Margaret Hill, your host, filling in for Bill today. And joining me now is Newsmax health editor Nick Tate. He's co-author of Da Vinci's Baby Boomer Survival Guide and the author of #1 New York Times best-selling book, Obamacare Survival Guide. Nick, thank you so much for being here. Let's dive right in. Let's say the health care bill, it makes it through the Senate. How is this going to impact the consumer?
Well, the first thing I need to say, Margaret, is that's a big if. We're already hearing from Senate leaders saying they're not even going to take up this legislation, but they're going to start from scratch and build their own bill. But if, in fact, it does make its way through the Senate, or if provisions of it do, there will be significant impacts on consumers. They'll vary, of course, depending on your age, your health status, what state you live in, and the insurance policies that states will now be able to set. A lot of what this Republican plan does is it turns back over to the states the ability to decide things like how aggressively insurers must cover people with pre-existing conditions and what kinds of coverage those insurance plans have. So it may vary state to state. But one thing we can say for sure will affect everyone is the individual mandate penalties. That's the tax you pay for not having insurance today, will go away. It goes away in the House plan, and the Senate is likely to pass that a provision as well, whether part of this plan or some other bill they take up. The other thing that goes away is the employer mandate requiring companies of certain sizes to provide benefits or pay a fine. So if you're an individual who's been paying a tax because you don't have insurance, you won't pay that tax anymore. But on the other hand, if you've been getting health care from your employer, you may not be getting it because your employer may not have to provide it any longer. So the impacts will be significant. I think it's going to take a while for us to see how they filter out and really to see if it's true that healthcare costs will come down and the quality of care will go up.
Got it. So I myself have been a victim of the Obamacare tax. And for people that don't know, what are some of the differences between the GOP bill on the table and Obamacare?
Well, Obamacare did provide, the first thing we should talk about is the pre-existing condition safeguards. Obamacare does provide safeguards requiring insurers to cover everyone who has a pre-existing condition and not charge them more. Insurers also can't set lifetime or annual caps on coverage. The Republican legislation, the American Health Care Act, amends that and turns that back over to states. States can decide to let insurers not have to live by that provision if they put in place things that are called high-risk pools, which would cover people who have health conditions. And there is some concern about the degree to which those safeguards might, in fact, be eroded. That's the first thing. There will be subsidies under the Republican plan. They're not as significant and as generous as under Obamacare. And there are other changes that have to do with things like Medicaid, which will become a block grant program, and effects on individuals who have, if you have children on your health insurance under the age of 26, they can stay on your health plan. And as I mentioned, the individual mandate and the employer mandate change. The big picture here, I think, is that costs for health care may come down, but they may come at the expense of having health insurance plans that are not as comprehensive and not as aggressive in terms of what they cover. So the critical thing for consumers is to be reading the fine point on any health plan you buy to make sure that you're getting what you're paying for.
Got it. So I want to take you to a healthcare epidemic now. Many communities are facing it. I'm from Kentucky, and I know that we have a serious problem with this. So opioid use and heroin abuse. Now, it's straining the resources that we have, from police to jails to emergency medicine. What can this administration do to stop this epidemic?
Well, it really is an absolute public health crisis. Let me throw some numbers at you. Every year, about 33,000 Americans die from drug overdoses. These are not, it's not just heroin, but prescription painkillers and other drugs. That's more people than die in car accidents every year. There are some things that states are doing to try to get a hold of this problem. The big issue is that many doctors are prescribing painkillers without really thinking about the possible long-term impacts. A lot of people who become addicted to heroin, 80%, according to the CDC, actually start as prescription painkiller users. So they start on painkillers because they have back surgery, knee surgery, arthritis, and then it progresses to the point that they go to illegal drugs, and that is ultimately what leads, in many cases, to these overdoses. In some states, regulators are trying to get a handle on the problem by requiring databases that require all doctors that prescribe prescription painkillers and opioids to log into a database who they're prescribing to so they can be tracked. What typically happens is people will go doctor shopping from one doctor to another doctor to another doctor, and none of those doctors know that 2 or 3 previous doctors have prescribed medications to them. A database system like this allows them to track. It not only identifies those individuals who shouldn't be getting these medications, but it also identifies doctors who are prescribing them in a way that we would certainly describe as irresponsible. I think that's a part of the problem. The other part of the problem is recognizing that addiction is really a significant public health issue that requires mental health care treatment, which is, in my opinion, underemphasized in this country and needs to really be a big focus. People need help. We should get it to them in a way that doesn't put them at risk of dying.
I hear you, and I couldn't agree with you more. Thank you so much for joining me. That does it for America Talks Live. I'm your host, Margaret Howell. Thank you so much for watching, and remember to keep it here where Newsmax TV. You can always stay connected, as well as Newsmax.com.
Have you ever forgotten a person's name? Where you parked your car? Well, episodes like this should not be dismissed, according to Dr. Gary Small, one of the nation's leading experts on brain health, who says most age-related memory issues are normal, but some can be a warning sign of future cognitive decline. A New York Times best-selling author, Dr. Small, has developed a free online memory test that can help you determine the state of your memory and what you can do to improve it. Just go to memoryrate411.com. That's memoryrate411.com. Take the test and learn more today.